Have you ever imagined somebody injecting petrol into your bladder and then setting it alight? You might have guessed it, today we're talking about bladder infections. If you have never experienced a bladder infection, you probably don't have the faintest idea what it feels like. It is one of the most agonizing experiences of a person's life. I'm wearing this t-shirt that I've always used when I'm doing renovation or painting work. It is full of marks and it is also full of reminders. I am reminded of the fact that when you're doing a renovation project like painting a room, you have to get the right supplies. You need certain paint brushes, you need the right kind of paint, you have to have done your preparation work. The bladder is just a holding capacity. It's a little pocket or a little bag where your body stores urine until you can make it to the toilet. The bladder doesn't produce any urine. Urine is produced in the kidneys and transported down to the bladder through these little tubes, and then that urine is just kept safe in the bladder until you are ready to urinate. The bladder, in particular in a lady, has a very, very short pathway to the outside world. The urethra is the small little pipe that moves the urine from the bladder to the outside, and it is a short distance. Now, the inside of your bladder is a mucous membrane, very similar to the mucous membrane on the inside of the mouth. That mucous membrane on the inside of the bladder is also equipped with immune cells that detect if there's infection and react to that. Despite the fact that urine is supposed to be completely clean, it is possible for problems to occur in the bladder. One of the problems is that microorganisms from the outside can track up the urethra into the bladder. This is something that happens less frequently in males because the urethra is a longer tube in males. In ladies, microorganisms such as bacteria can easily make it into the bladder. When ladies are a little bit older and the bladder has dropped down a little bit or has lowered in position somewhat through the weakening of muscles and ligaments in that area, the bladder being lower down is also closer to the outside. In other words, the urethra can actually become even shorter, making it that much easier for organisms to track into the bladder. Germs coming in from the outside is only one of the possibilities. There can be irritation from inside the body. There can be factors inside a person's body that make it harder for the bladder to deal with microorganisms when they do get in. Under normal circumstances, microorganisms or germs that go into the bladder are very quickly detected and very quickly killed off by the immune cells present inside the bladder's lining. The distance between the bladder and the outside, as well as the condition of the bladder on the inside, are two factors that have an impact on how easy it is for a lady, or for anyone for that matter, to get bladder infections. But a third factor that plays a tremendous role in how quickly UTIs can develop is the condition of mucous membranes, not only in the bladder but also in the entire genital area. Mucous membranes are supposed to be wet. They're supposed to remain moist, and microorganisms flourish in a mucous membrane that is too dry. With age, as well as hormonal imbalances, and for various other reasons, women can experience dryness in the genital area, including vaginal dryness. And any dryness of the mucous membranes in these areas can actually cause microorganisms such as harmful bacteria to overgrow and to flourish. When harmful microorganisms flourish, there's usually a complete imbalance with not only an increase in harmful bacteria or funguses for that matter, but there's also often a decrease in the helpful microorganisms that usually help to keep things in balance. When this imbalance occurs, the harmful bacteria can overgrow to such an extent that their sheer volumes increase the possibility of them tracking up into the bladder. And the immune system is just simply not able to cope with the volumes of microorganisms in that area. Now that we understand that these are all different factors that play a role, let's look at some of the things that we have to keep in mind when we're actually trying to reduce the frequency of bladder infections or treat them altogether. Years ago, when I was struggling with recurrent bladder infections, I was referred to a urologist. And one of the things that they recommended was a cystoscopy or other investigations where they can actually look at the inside of the bladder. And they try and find things like to check if there are tumors growing there or if there's anything else strange happening there. But in the vast majority of cases, patients that end up going to a specialist for recurrent bladder infections will come back with a clear report that the urologist found nothing. They often do cystoscopies and other investigations and come to the conclusion that they can't see anything wrong as such. And of course, then what is most commonly prescribed is a long-term antibiotic where ladies have to stay on this particular antibiotic day in, day out for sometimes 6 to 12 months to try and keep those microorganisms, the harmful ones, at bay. But before we investigate that option a little bit further, let's backtrack. I want you to take a few moments and imagine that you have identified a rat problem in your house. If you don't solve the issue of where those rats are coming from and what they're being attracted to, I don't think you're going to get control of the issue. In many ways, when we're trying to solve a problem like a recurrent infection, in particular a recurrent bladder infection, we have to attack this problem with many different strategies. And now that we understand a little bit more about what the bladder looks like and what the risk factors are that increase the possibility of recurrent infections, let's talk through some of the strategies that we can use. One of the first things that I encourage patients to do is to starve out the harmful bacteria. I don't know if you're aware of this, but there are many things that we eat that actually debilitate our immune systems. But many of the things that we eat actually feed harmful microorganisms. Anyone who eats a diet that contains a lot of sugar, as well as a lot of processed foods, which contain chemicals, additives, preservatives, as well as other factors that irritate our immune systems and irritate our mucous membranes, those diets are going to aggravate the problem. Sugar is a very, very prominent factor that aggravates bladder infections because bacteria and harmful fungi feed off of sugar. The more sugar we take in, the more food there is for these microorganisms to use as a food source and for them to grow and flourish and multiply at extreme rates. Your easiest defense against most of these repeated bladder infections is to cut away the food sources for these microorganisms. And the best way to do that is to cut out all sugars. Now, in the case of bladder infections, especially if it is a recurrent and a very severe problem, you may need to stay away from not only cane sugar or additives in the food, such as processed foods, but you might actually need to starve them to the point of not having anything that is sweet for an extended period of time. There are some sweet options that definitely are healthier, such as honey and dates and apples, things like coconut sugar, agave syrup. There are various options, and these are certainly better. But cane sugar in particular is an acid. It is a toxin, and it is added to almost all processed products on the market. Even things that are predominantly savory often contain very, very big quantities of cane sugar. And cane sugar is an extreme poison in our bodies. It causes havoc on so many different levels, and I will not even begin to list all the ways in which it causes damage to your body. But one of the things that is particularly relevant when we are dealing with infections is that cane sugar actually paralyzes your immune system. So you're dealing with a product which basically flourishes or causes bacteria and viruses and fungi to flourish. But you're also dealing with something, a substance that paralyzes your army, that makes your little soldier cells unable to fight. This is a recipe for a disaster. And one of the reasons why I so strongly recommend that people who suffer from regular bladder infections or any other infections for that matter that they're struggling to clear up, their first strategy should be to starve those infections out by cutting away all, as in all, processed products and all cane sugar. In an effort to really stay away from cane sugar, one has to stay away from things, not only the sugars that you add with a teaspoon into your drinks or over your cereals or your porridges, but you actually have to stay away from cereals and other processed foods that are often part of a common diet. The next strategy that is so crucial when we're trying to deal with recurrent bladder infections is, as we've mentioned, not only starving the bacteria or the harmful microorganisms, and not only staying away from sugars that paralyze the immune system, but we actually want to boost the immune system. Ways that you can use to boost your immune system is to feed it with the right ingredients. Just as I need to get the right supplies when I'm doing painting projects, in the same way, you have to supply the right ingredients for your immune system to build into a strong army. And for that, you need a good supply of fresh produce. Fresh fruit and vegetables contain enzymes, minerals, and various other elements, such as vitamins, which enable the immune system to build into a stronger and stronger army. Fresh produce is essential for building your system. And staying away from all kinds of processed foods is really important. But one of the things that people often also don't realize is that dairy and animal products also debilitate your immune system. If your total food intake contains more than 5 to 10% animal-based products, the process of metabolizing those animal-based proteins will actually leave a residual metabolic waste that your body is not able to keep up with. And because of that buildup of metabolic waste that your body is not able to clear fast enough, it not only pushes your blood into a more acidic state, but it actually causes various other processes that make it harder and harder for your body to keep up with its processes of detoxing. When toxins build up, the immune system gets weaker and the detoxing organs are not able to keep up with their duties. So if you're able to keep the overall toxin levels down by staying away from sugars, processed foods, and animal-based products, you're doing a tremendous job at helping your immune system and detox organs to keep up with what they're supposed to clear from the system. And of course, that helps them to keep up with fighting the infection as well. Now, if you're able to starve that infection, boost the immune system, and help your system keep up with detoxing levels, you've already done a tremendous amount. But there are other things that you can do as well. You can stay away from irritants, things that irritate the inner lining of the bladder, such as alcohol, cigarette smoking, and even caffeine. Even the commonly used things like caffeine, which is present not only in coffee and tea, but in many drinks, energy drinks, as well as the common things like chocolates. All of those things irritate the inside lining of the bladder, and it actually aggravates the inflammation of the bladder lining. A raw and inflamed mucous membrane is always more susceptible to struggling with infections. Last but not least, we want to help the body to maintain a healthy hormone balance. If our hormones are out of kilter, it is so much easier for dry mucous membranes and irritated mucous membranes to be an environment where infections can flourish and grow more easily. Dealing with hormonal imbalances is a complicated process that I'm not able to explain in one video like today's video. But one of the things I can mention is that the things we've already mentioned, such as cutting away sugars, staying away from processed foods, staying away from irritants and irritating chemicals, and keeping the diet fresh and full of wholesome plant-based produce. These things will not only help to strengthen the immune system, but they also have a direct impact on helping our bodies stabilize the hormone levels. So if you are struggling with hormonal imbalance symptoms, not only things like vaginal dryness and bladder infections, but also maybe symptoms like hot flushes or other hormone imbalance symptoms, all of these things are red lights that should flicker and encourage you to stay away from the harmful things and use the good things in a good and moderate way. A really well-balanced, healthy, plant-based whole foods diet is one of the best ways that you can boost the immune system and stabilize hormone levels. But something that comes along into this process, like the multiple strategies that one would need to use if you want to solve a rat problem, is the rest of the New Start principles. Getting enough fresh air, getting exercise, spending time outside, getting good quantity of quality sleep every night. All of these factors are also important and contribute to stabilizing the problem. A high stress environment and a high stress emotional state contributes to hormone imbalances and excess of stress hormones, imbalances with your blood pressure and your metabolic functions, as well as many other factors that actually make this problem worse and make it harder to keep it in check. Now, one of the things that people often also ask me is, what are What are the other natural things that I can do to actually treat a bladder infection? If you are already doing these things, if you're staying away from sugar, if you've cut out caffeine, alcohol, smoking, if you're staying away from processed foods and you're boosting your system with healthy, wholesome, plant-based foods, what is there that you can do? What more can you do? If you're applying the New Start principles, the question is, are there other things that actually actively treat a bladder infection? And the answer is yes, there are some things. There are herbs such as nasturtium, thyme, as well as things like uva ushi or bearberry, which is the other name for it. These kinds of things actually target the harmful microorganisms and help to kill them off and reduce their numbers significantly. There are things like cranberry and other berries which line the inside of the bladder, and within the inner bladder lining they actually prevent those microorganisms from colonizing on the inner bladder lining. So these are herbs that can help. The other thing that can be very helpful is to apply charcoal poultices over the bladder area. And if you are not sure how to make a poultice, I want to encourage you to check out our poultice video on the YouTube channel. Now, in addition to herbs and poultices, it can also be very helpful to just pay extra attention to hygiene and make sure that your whole genitalia area is washed clean on a regular basis. However, I would not recommend that you increase the usage of strong chemicals like soaps just because you're worried about infections in that area. And this brings me to another very important point. If we kill off not only the harmful bacteria or microorganisms, but we actually damage the good balance or the good microorganisms, we're actually making the problem worse, because those good microorganisms are part of the army that fight off the bad ones. If the good germs are not strong enough, if there are not enough of them, if their numbers are too low, the infection of the bad bacteria or fungi will actually flourish and thrive. So it's important in our strategy that whatever we do, we don't actually disturb the healthy bacteria and the healthy microorganisms. And unfortunately, when we use very strong soaps or other chemicals to wash with or to rinse with, those things will damage the healthy microorganism. To keep a good balance of that area, I would recommend that you don't use any soaps for that matter. For an overgrowth of fungal infections such as in thrush infections, it sometimes is helpful to add a small quantity of vinegar to your bath water. You can also use things like making a tea with onion and garlic, and you can use this not only to rinse with but to wash with, and you can also add some of the garlic and onion tea to your bath water. The good thing about garlic and onion is that they contain antibiotics or antimicrobial substances, but those antibiotics actually only kill off the harmful things and they don't kill off the good microorganisms. Now, in addition to these strategies, we have to bear in mind that if we are using any products that actually damage the normal gut flora in our bodies, or anything for that matter that damages the normal flora of the mucous membranes, we're actually making the problem worse. And it's not only the soaps or other chemicals that we use from the outside that can do this. One of the most common ways in which the gut and the mucous membrane flora is completely destroyed is by taking antibiotics. I am not here to tell you that all medications are bad, and I'm not here to tell you to stop medications that have been prescribed to you by other medical professionals. But I can tell you one thing. I have never seen any patient recover from recurrent bladder infections by killing off bacteria. I've only ever seen strategies that really work when we're protecting the normal gut flora, and antibiotics unfortunately don't do this. Recurrent antibiotics, which is often prescribed for people who have recurrent bladder infections. Personally, I've only ever seen that doing damage. If you have questions based on what I have already shared with you now, or if I've shared information here today that you find to be contradicting or that you think contradicts with other information that you've received from other healthcare professionals, I want to encourage you to engage in a discussion with me. And I really want to encourage you to just share with us what your experience has been, share with us what has been recommended to you and what you have found to be very helpful, what has worked for you, and what other questions do you have about this topic. I wish you all the best on your journey of renovating your health.